Please subscribe, follow and like engineeringall.com.
In this video, we will be discussing about prosthetics and how prosthetics work. Prosthetics was invented by biomedical engineers who believe that damage to the arms or legs is not the end of the road. It was built to make disabled people who are either victims of accidents or casualties leading to amputated arms or legs to still be able to live a normal life. Prosthetics involves the designing and fabrication of artificial medical devices to replace a damaged part of the body, probably an amputated leg or hand, by biomedical engineers who develops equipment to solve healthcare problems by using all the concept of engineering to build medical instruments. People whose arms or legs were amputated will need prosthetics in order to live normally, and these prosthetics work like normal body parts. The type of prosthetics to use depends on the level of amputation, either it's above or below the knee and above or below the elbow. Below the knee, prosthetics are easier to use as there are remaining bones to cushion the prosthetics compared to above the knee prosthetics. Prosthetics to be used can also depend on function, since the prosthetics used for legs is solely based on movement, but since the hands is multifunctional, it's used more, therefore, the prosthetics used for the arm may differ. Composition of prosthetics. A lot of things are used to develop the prosthetics, different materials for different parts of the prosthetics. The materials for developing prosthetics can range from plastics, polyethylene, polypropylene to acrylics. The first and most important thing is that prosthetics should not be heavy, as it may pose as discomfort to the patient, hence prosthetics should be lightweight. It's best if prosthetics are lightweight, as it will ease comfortability for the patient, not that it should then become a burden to the patients. Lightweight metals can be used for this purpose. Examples are aluminium, titanium. Carbon fiber can likewise be used. Durable. Prosthetics should be able to last long and not susceptible to wear and tear. Easily attached. Prosthetics should attach easily and firmly. Prosthetics that involve the use of electronics uses battery. The sockets is the part of the prosthetics that are attached to the remaining bone in the limb. This should be done with utmost care, as irritation and wear and tear can affect this bone. The suspension system is what makes the prosthetics remain attached. This can be in form of a belt or suction. The pylon, this gives internal support to the arms or limbs. It is made from carbon fiber. Mechanisms of prosthetics. Prosthetic work based on the functionality, the method of designing, the part it's intended for, the health of the patient, and the patient's preferred choice. Cosmesis. This is referred to as cosmetic prosthetics and can also be known as passive prosthetics because it's solely based on appearance rather than function. This is built to make it similar to a normal arm. A pigment that matches the patient's skin tone is used to make this type of prosthetics. It's built in a way that it may be mistaken as a real arm or leg, as all features of the arm are integrated into it. Functional prosthetics. This type of prosthetics is mainly built with function in mind. It can perform simple functions like opening stuff or holding objects. Body-powered prosthetics. This kind of prosthetics is controlled by cables that are connected to the body. The cable can be attached to a strap that is mounted on the shoulder, preferably opposite to the injured arm. Externally powered prosthetics. These prosthetics are powered by the help of motors, and the patient can power it by using a switch or electrodes that are placed on the remaining bone that can still contract. Hence the contraction of the muscle will power the limbs. This prosthetic has helped a lot of patients to be able to live comfortably and probably go back to their normal lives without hurdles instead of appearing stuck in life. Though this prosthetic hasn't been said to be able to fully perform the function of a healthy arm or leg, it has sure helped in some function of the damaged part, and there are still advances in this area by biomedical engineers to see how prosthetics can be improved and if it will be able to perform a larger extent of what the healthy body part does. For watching, please hit the red button to subscribe for more videos. Please follow and like engineeringall.com in all social media.